What is the methodology and the technique to do a perfect handstand, and to learn how to teach it and to do it in a very good and consistent and sustainable form? So, well, first of all, the prerequisite for this form, for this skill, are several, and this is actually a very good skill to have as a goal, because you need to unlock and unveil a lot of other things in your body to be able to do it properly. So the first thing is the shoulder mobility and the scapula mobility. Just to give an example, this should be a mobility that allows you to reach. If you're standing on the floor, you could reach with the forearm and the whole arm, actually, the floor, but without losing the spine, the whole spine touching the ground. What does it mean? It means that the angle between your spine and the arm is 180. So you will see that if you lay down on the floor, many people can probably touch with the whole arm the floor laying, but when they touch with the arm, the back will actually lift. There will be a small space, especially in the lumbar back or even in the upper back. So keeping the whole spine on the floor, can you achieve full extension, full opening 180 degrees of the arm and the shoulder? If the answer is yes, then you have the prerequisite to do handstand. If no, you will do a handstand that is not straight, and so is not sustainable, is harder to keep, and will require more force. Actually, you can even do handstand in every angle, but only the angle under 80 or perpendicular to the ground is the angle where you don't have any force and you don't need much strength except for balancing. The second thing is the wrist. You need to have a very good conditioning of the wrist, because you will put the whole weight of the body on the wrist, and it's a very small part of the body that needs to hold the whole weight. So it requires a lot of months of conditioning, constant, every week, every day, making it strong, like with the wrist push-up, with the wrist push-up on the wall first and then going down. There are a lot of progression to get conditioned your wrist. Then have a really good control of the hollow body position. I like to say 5 minutes of hollow body hold, for example. That's a good way, because if you can do 5 minutes on the ground of hollow body hold, like a banana position where the whole back is touching, then you can probably do 1 minute of handstand. So it's something that is a prerequisite. And keep also the whole body tight, like a piece of wood, like a piece of cement. Like you put yourself in a position and you stay there, whatever the orientation of the body it is. That's the third requirement. And then have really a good sense of equilibrium. So there are actually many people that have this as a natural gift. If you don't have it, you just train it. But if you have it as a natural, maybe you can hold a handstand, you can balance it, but it will not be effective, and you actually spend the energy to keep yourself in strength. You will need to use your strength to keep yourself in balance. And then, of course, you need to have some strength in the shoulder, because you need to push yourself up in the position. So if your hands are on the ground, your body needs to go all the way up as much as you can. So this requires some scapular strength to expand and not collapse your spine, but to keep it nice and expanded and long. And then, of course, the last prerequisite is don't be afraid to fall. If the student or whoever is trying is afraid to fall, of course, you will not dare to do it. So actually a very good exercise first is really to learn how to fall. And the way I learned from Andrea Valtorta, Italian champion on gymnastics for parallel bars, his approach is divided in three main objects. Handstand is a skill that you can learn if you decompose and train these 3 elements. The first element is the positioning of the shoulder. So what we are saying, the mobility and how you move the shoulder away from the ground, and you use the shoulder and the scapula to extend, to make yourself long. And as a reference, you can use the fact that your arm should cover completely the ears. So if your ears are out like this, there is space, then it means that you're not enough strength. So you need to train that thing of closing your ears with your arms, actually. And another good thing that I understood is that your armpits actually should look at each other in handstand. So the shoulder should be in strength, in a strength position, not open all the way up, like many times I heard in yoga to open. It will not allow you to have control on the handstand. And of course, when you are in the shoulder, you will need to do a lot of small adjustments. So really try to train this position, train the fact that the armpits are close, looking to each other, but with the extended open 180-degree angle from the spine. I know it's something that needs to be trained. And then that they can have the strength to push up and down the body. The second part is the control, the motor control, and the keeping the body in a strong, tight core position. And this is another thing, that the quads, the glutes, the lower back and the abs should be mobile. So you should have not super tight, but also they should be really strong, because as I said, as a reference, you can take 5 minutes of hollow body position. It means that you can probably do 1 minute, keep the same position in 1 minute in handstand, using also your arms. And then it's very important, the last one, the equilibrium, the balance. So this is something that people have some talent, but it requires a lot of time, because we are upside down, and we are not used to be upside down. So the more time you spend upside down, the more it becomes natural, and you understand the balance. It's actually the opposite of what you think it is, because we are always with the feet on the ground. And another thing, if you imagine a stick, and here it comes back the hollow body position. If the body is very straight, you can balance like a stick. If the body is fluffy and soft, it's very much harder. So imagine that you take a stick with your hands and you balance it. If the stick is tight, you can actually move from the bottom and keep it in balance. If it's all fluffy, no. So core tight, the whole body line is tight. Try the alignment with the shoulder, hands, the shoulder, hips, and the feet in one line. Extend it, and then it's all about balancing that. If you're falling with the feet forward, then you can push your shoulder in the other direction to balance it, and put more pressure on the toes, on the fingers. On the other hand, if you're falling back, you should put more pressure on the heel of the hand and move close your shoulders. So this is something that will come natural as far as somebody trains in the handstand. And these are the 3 elements to have a successfully perfect align and looking good and effortless handstand. How can we train with some propedeutic exercise, with some progressions, the handstand? So first we can work is for the shoulder. First element is to just lay on the ground and with the belly down, and be really tight, like a line, feet together, knees together, everything like a nice line, and touching with the chin so that you can actually see just a little bit your hands, but without really arching too much, just a little bit so you can see. And with the hands, just keep your core tight, keep your glutes tight, simulate basically the position of a very tight piece of wood, and then you can lift just 1 or 2 centimeters or inches the hands from the ground, keeping the elbow straight. You can do that with a bar, with a weighted bar if you want to really train that, or with elastic bands, but that's a good way to feel the opening of the shoulder and feel the position. The same position can be done with the belly up, and here you need to reverse, you need to push down your lower back on the floor, and try to push back, maybe with a weighted bar, the hands towards the ground, never sacrificing the lower back. You can do 3 sets of 30 seconds on one way, 3 sets of 30 seconds with the belly on the other direction. Then you can do the handstand 90 degrees, which is the L. So you can put your feet on a cube or on a sofa if you're training at home, and then you can just push your shoulder so that they're in line, the hands, the shoulder, the hips are in line, and then of course the legs will be on the sofa or whatever is the furniture that you're using. Here the focus should be on really pushing with the shoulder, closing the ears and keeping the armpit one to each other, but opening the shoulder and pushing that towards the furniture, toward the sofa, toward the cube. Also here you can do 3 sets of 30 seconds, just holding like that. In that position you can do some variation if you have mastered the 3 per 30 seconds, which are shifting from left to right, or going into plank and then pushing back there. That's also another way to do it. Plank straight and then pushing the shoulder back. You can do handstand push-ups from there with the legs at 90 degrees. So you go down, you touch with your head the floor, and then you push up, and there when you push up, you really try to close, and then you let go the shoulder, and you really try to close, and then you shoulder. The head, very important, needs to watch in between the hands, or a little forward, not like that, and not your feet, but a little forward, because if you keep the head like that, you should basically have a position where the head is not stressed, you don't feel pain in the neck, but also just not feel the pain in the neck like this. Well, a little forward will help you actually to open maybe a little bit the shoulder and have also stability on the side. Of course, once you have an expert, you can move the head wherever you want, but that's to explain how to learn and how to teach also the handstand. Then a great exercise to do the handstand on the wall with the belly on the wall. So this is same things, keep the position, the tight core, the shoulder, etc., but really try to be in line. The wall will force you to be in line, and you can do 3 per 30 seconds. You can do the same, touch the shoulder, shift left, right, and also do the plank work, so you can actually push down and do a handstand push up on the wall. Okay, the second factor is the work on the core. To work on the core, you can do all the plank work, the core work, hollow body, all that. It's the basic of gymnastic calisthenics. On top of that, you can go on the floor in the same position of the handstand, so Superman position, and do the posterior anterior pelvic tilts, like 10 reps, 3 sets, for example. You can also do on the wall or on the floor, you can go the reverse hollow body, so just your hands and your feet are on the ground and you stay in that position, holding the core, keeping the core tight, The same you can do with the hands on the floor and the feet at 30-40 centimeters. You can go up 45 degrees, 1 meter, etc. So you can tilt and get strength on your core. Or you can put 2 steps or 2 elevation and put with the belly down your elbows and your knees on them in the handstand position and hold, so that you are like the table, like a table surface. You can do the same belly up, but harder, where you put just your feet and your shoulder there, and you just hold there in that position. And really, I like to put this work of the core maybe at the end of the training, so that you can even do more of strength work. And the last one is about the equilibrium or balance. The last step to train. The progression you can do there is just to, when you do the handstand 90 degree, you can pull up one leg from the block. So if you're on the sofa, your feet are on the sofa, you're in the L handstand position, you try to lift one leg as you are in the handstand. Of course the other is down, help you to balance, and you stay there for 10 seconds. Really sturdy, really stable. Don't try to jump, etc. No, just feel the position, like they are very focused and very not fidgeting. Then from that position you can do the same, but switching the legs. So you can you have a moment of no contact, or you can do with contact, so you wait one leg, or you can do without contact. You can do 5 and 5. Also, this is a really good one. You can go on a handstand on the back, which is something usually that you don't know to train handstand. Just a handstand on the back of the wall, and you are very tight. Your heels are touching, and you are not attached but like 5 or 10 centimeters from the wall. From that position you start to pull one knee towards your belly, and the feet should not stay on the wall but should be 90 degree with the knee. So slowly you see that at some point, probably when you arrive to 90 degree, the pelvis will want to do an change to really posterior pelvic tilt. In that moment, without doing anything, the other feet should go away from the wall naturally, because you are doing a posterior pelvic tilt. It should not be forced that you're kicking out that, but it should be really slowly controlled. Oh, I feel it. And once you feel that you're going away from the wall, that's where you need to push forward a little bit your body, your shoulder, to counterbalance that that effect, and then you will find yourself in balance. It's a really nice sensation. I really recommend you to do it. You can do that 20 seconds slow descent one leg, and then 20 seconds slow descent the other leg. Also, you can do the same, but in handstand with the back on the wall. You can slowly move the shoulder, keeping the body very tight and keeping the heels, the feet on the wall, and you can try to balance, find a little bit small correction of balance from your shoulder. You can do 10 repetitions for 3 times. And then you can also do from the handstand on the wall. You really start to move until you go off the wall, and there you try to balance and you go back on the wall. So you do bounces on the wall with your heels. You can do bounces together, or you can do alternated bounces. So you feel the equilibrium, the balance. And then you can just do, once you have that, you can try to go into the handstand from the ground free. And the recommendation here is to already preparing the position. So you see many times gymnasts that start the exercise already with the hands up. It's not for aesthetic, but it's because they set mentally the body in that position, then they keep it, they don't have to think about it. So they just go into the handstand position, just tilting their body, but they don't move the shoulder, they don't move the core, they are already in the position reversed, and then you just flip up and they go in the handstand. So that's really nice also to feel the whole thing together. And the last part that I would like to show is how to fall, because this is really important. Actually, we should start when teaching. The first thing is, how can you fall from the handstand? And there are two main ways that are very effective and simple to learn for a beginner. And one is to fall as a roll forward, or to just fall laterally on the side. So it's recommended that you try the first fall assisted with somebody else. Don't try by yourself, or don't do that by yourself. Or if you're teaching, try to really assist the person. So the first one, just go slowly, hold the legs, the thigh of the person that is in handstand on the wall, slowly go down and curl like a shrimp the upper body, and then you can roll from there. Just collapse the body, do a roll and roll forward. If the roll from the top is harder, just try the roll from the ground first. Just roll like a kid with the mat. Or the other one is the lateral or side falling from the handstand. So just in a handstand position, if you just lift one arm and keep the other straight, you will actually fall on the side that you lift the arm. So the trick here is, when you fall and you're close to the wall, because you have your belly on the wall, you also rotate inside your hand. If you rotate inside your hand, this will make you fall slowly on the side, because you don't have one pod, one attachment, one arm. But if you rotate, actually it will close and will allow you to do like a cartwheel basically. And which side should you go for? You can do the test of the falling. So you're standing, you're losing your balance with closed eye, you see which legs goes first, and that's your direction of spinning, the external rotation of spinning. Or you can do like a jump. There are several ways to discover that, or just try both and see which one is the most natural. It should be just natural and fast, because it's something that you need to do when you're in emergency or falling from the handstand from the wall. You can also fall on the wall, but then you need a lot of space, so it's much easier if you just slowly controlled hold and go like a cartwheel on the side. And another important thing is for the handstand is, try to think is like standing. When you stand, you're on two support points, which are your feet. Handstand is the same, you are on your hands. So why one is harder? Well, our feet are trained to do that. Our hands, no. They are much bigger and stronger, and etc. But it's the same. And if you actually observe how we stand, you can actually learn how we can do a handstand. For example, if you're standing, you close your eyes and you go forward, you lean forward a little bit without falling, you will feel in your feet, and I invite you to do it, that your feet will actually activate. It will do like this grabbing motion, even if you have shoes. The same is in a handstand. Like when you're in a handstand, you should have your hands active, and if you're okay in perfect balance, but then as soon as you go off the balance, you should use this grip of the fingers to keep your balance, and use that as a strength point together with the shoulder. The rest of the body is a piece of wood, so you don't have to worry about that. You just have to, and you have a perfect handstand. And progression to learning for yourself.